could just ask our wonderful panelists for part 2 to turn their videos on, if they're able to do so. Struggling to do my own. Great. All right, so if we could have all the beautiful faces on screen with videos on, if at all possible. We're going to turn now to the second part of today, which is our panel discussion. And I mentioned in the chat that it's really fantastic to see who we have online today. We could have 100 of you on the panel. There's some fantastic experience on the line. People have already been sharing challenges and opportunities that they see in this field. So we have a very kind of live practitioner audience. So please, we're going to try and maximize time for questions and answers at the end, and we have a lot to learn from all of you online. So we will get cracking. One tiny second. There we go. So a huge welcome and thanks to the panelists that we have today for joining us and for taking the time to do this. Huge thanks to Julie and also to Paul and Gabby for setting out some of this really excellent research. What we want to do for the second half of today is to shift gears a bit. We've heard a lot in the first half of today about the importance of better linking humanitarian cash and social protection. We've heard a lot about the different models for doing that, the nuances of different contexts. We've heard about the current state of play and what the research team have seen as some of the key challenges and opportunities. And that's been coming out in the chat as well, which is excellent. We now want to turn to this group of practitioners that we have with us from across the region, people who are without a doubt making this happen, people who are on the front line of linking cash and social protection and are getting this done. We've asked each of them, based on their experience of what has been working well, to set us, the audience today, and CaLP and all of the organisations represented online, to set us a challenge, to challenge us. What do they want to see us doing differently? What do current ways of working look like from different perspectives, from the World Bank perspective, from the government perspective, from the donor perspective, from the perspective of local actors, and what do we need to change? So what does this group of practitioners see as the key blockers to progress and the best ways for addressing these? So it's my very great pleasure to introduce today's excellent panel. You'll notice that there are quite a lot of us. This is bigger than a standard panel would be. And the reason for that is quite deliberate. The state of the world's cash, as Diksha has set out in the earlier presentation, says that the biggest challenge in better linking humanitarian cash and social protection is getting coordination working between the very many sets of actors involved. And all of you on the call know how complicated that is. It's not simply about setting up a meeting and having the right people turn up. It's finding the people within each organization, each group of actors that are able to make change. It's building lasting relationships. And it's, as Gabby and others have mentioned, it's about challenging mindsets and working together in a different way. So we wanted to hear from representatives of a broad range of actors involved to understand how progress, challenges and opportunities look from their perspective. Now, because there are a lot of us, I'm going to be very strict on timekeeping. So panelists, please forgive me in advance if I move you along after your 5 minutes so that we have time to hear from everybody, including the Q&A. We have on our panel today Zara Rizvi, who's the newly arrived social protection and cash specialist for UNICEF. And as many of you will know, she comes to that role from her previous position with the Grand Bargain Cash subgroup on linking social protection and humanitarian cash. We have Haula Abu Sarara, who is the head of analysis and programming at Jordan's National Aid Fund. We have Haneen Syed, who's a lead specialist on social protection and human development with the World Bank in the region. Sarah Palmer-Felgate, who is the social development advisor with DFID Yemen. We have Salma Zaki, who's a social protection officer with WFP in the regional office. And last but not least, we have Maisa Ibrahim, who leads the basic assistance program for the Lebanese Red Cross. So we're going to hear from all of them in just one short minute. But before we turn to the panel, I want to recap a couple of the key points that we've heard so far today. So just make sure that we agree on what the jumping off point is. Firstly, the State of the World's Cash heard from hundreds of practitioners. The inputs to this document, which Gabby was one of the lead authors on, was phenomenal. So we listened to hundreds of you across the system. And what was almost universal is that all of you, more than when the last report was published, see, understand and feel the urgency of the need for humanitarian actors to work with, through, and alongside social protection systems in many contexts. So it's really well understood, and it's top of everyone's list. It's clearly on the radar as an issue. And we're seeing some progress in many places. As Yorgos mentioned, Laurent Bouquera, who's the head of WFP Yemen, helped us launch the State of the World's Cash report last week. And he argued that the main focus for us as humanitarian cash actors now is no longer about trying to globally scale up cash or trying to figure out what the measures of quality are necessarily. It's about delivering in ways which help to build and support sustainable, nationally led systems, which can continue to deliver long after international actors had left. And I thought that was a really powerful point. Third, at a time in history when humanitarian needs are skyrocketing, we know that the UN Global Appeal is 25% higher at this point this year than it was last year, and it's likely to grow further. Needs are skyrocketing, and aid volumes are set to fall drastically. We heard from development initiatives and OCHA this week that we're looking at up to a 20% fall in humanitarian financing in 2021. So there's never been a more important time to make sure that all of the funding flows, so that's humanitarian donors, development actors, international financial institutions, and national governments, are mutually reinforcing, are working together for the same outcome. We don't have a single dollar to waste. This is no longer a kind of luxury intellectual problem. This is a now problem, and we need to get it sorted. Next, we unfortunately learn also from the State of the World's Cash report that progress in this area is pretty patchy, pretty slow. And as Dick has already outlined, the three key reasons for that, you think, are lack of coordination between the actors involved, the challenge for social protection systems of responding to shocks, and finally, a lack of social protection expertise among humanitarian actors. So this problem of us speaking different languages. Earlier this year, we as CaLP worked with the Emergency Relief Coordinator's Office as they started to advocate for a $90 billion package of assistance to mitigate the worst economic impacts of COVID-19. And all of the narrative around this funding was correctly that the majority of this funding should flow through the governments of the worst affected countries and be delivered directly to people as cash transfers through social protection systems. Great, we can all agree with all of this. But the problem is, what do we do when we're working in contexts where the reach of national social protection systems is limited, or when key vulnerable groups, refugees and migrants notably, aren't covered? How do we tackle that? How do we work better together as humanitarian and development actors and with governments? There's a clear need for humanitarian actors to work more closely with governments in many settings to ensure that all those in need, including those who've unfortunately been made newly vulnerable by this crisis, receive assistance. But what's also clear is that the different actors involved in this understand far too little about each other. We speak different languages, we have different metrics, we have different coordination systems, and we need to change that. As Ruta, our lead consultant for this work, mentioned in the chat, we are conducting studies currently in 5 countries, including in Iraq and Yemen, with OCHA, to look at who is covered through humanitarian cash and who is covered through social protection systems, where there's duplication and where there are gaps. And what we're finding is in many places, the data simply does not exist. We don't know at the moment what the combined reach of these different systems is in many contexts. So I should say at this point that as we ride this wave of renewed interest in linking better between humanitarian cash and social protection, it's important that we don't get carried away. And I think this came out clearly in Gabby's presentation, but I just want to reiterate it. There are, of course, many, many contexts in which working through governments and national systems is not an appropriate way to ensure that people's needs are met, and where humanitarian actors need to be very clear and very assertive about their role in meeting needs in a principled and inclusive way, ensuring the protection of the people we serve. So this emphasis on the need for closer working in many contexts should not be misinterpreted as a call for joint working everywhere. As we'll hear from today's panelists, every context is different, and every context requires different modes of partnership and coordination. But let's be crystal clear that focusing on the humanitarian development nexus does not mean a wholesale abandonment of the core role of humanitarian actors in many challenging contexts around the world. So that's quite enough from me. We're going to start today's panel with a hypothesis to test, a theory to test. And this hypothesis is that despite the significant research and interest that we've heard about today, actual progress on the ground in linking humanitarian cash and social protection is relatively slow. We're seeing pockets of progress, we're seeing pockets of good practice, but the whole progress is slower than we would like to see. So we're going to ask the panelists whether, firstly, they'd agree with that, and then critically, what can we do to speed up progress and improve linkages where that's appropriate? So before I turn to each panelist for an in-depth presentation, I'm going to ask the same question of all panelists and just ask them to answer in 1 or 2 sentences, so a quick 30-second answer. So what I'd like to understand from each of you, and I'll call on you one by one, is what do you see at the moment as the single biggest barrier to closer linkages between social protection and humanitarian cash in this region? So Zara, over to you.
Thanks for that, Sophie. The single biggest barrier that I'm seeing to closer linkages is personalities. We talked about creating that enabling environment, having people who can speak to both sides. Paul's presentation talked about that. This is a big, 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 big focus area, and it's not a technocratic solution. It's a people-centered solution. And this is personally from me, not necessarily from the UNICEF side, but personalities.
Great, thank you, Sarah. What a great way to get us started. Halwa, can we hear from you? What do you think, what do you see as the biggest barrier to closer working?
Thank you. From our side as a government, the biggest problem is the financial problem, the financial support that we can help people with. We depend on humanitarian agencies or actors to support us because the government financial is, especially at these moments, is very hard. So this is, from my opinion, is the most difficult thing.
Thank you, very clear and very topical at the moment. I mean, it's a huge problem for all of us. As needs increase, as funding dries up, what are we going to do with the limited resources that we have to meet humanitarian need? Thank you. Haneen, could we turn to you? What do you see as the biggest blockage?
Hello. Hello. Hi. Sorry, I was trying to unmute. Thank you very much. I think there's 2 blockages. One on the government side and one on the humanitarian community side. On the government side, it's everything put together in terms of, I wouldn't say capacity, it's beyond capacity, but it's decision making, policy making, that in terms of addressing the very large challenges, even though we're in many years into the displacement situation, but it's still been difficult for the governments to adapt to taking the kind of decisions at moment, right time and so on. On the humanitarian system side, I think there is still fragmentation. We see it from sort of development point of view, although that has gotten better, but I think that has been one of the challenges that we've experienced. Thank you.
Great, thank you. Really useful, and so useful to have your perspective looking at both sides of the equation. Sarah, if we could hear from you, what do you see as the biggest blockage to closer working?
Thanks, Sophie. I think one of the main things would be the competing agendas and global mandates as well of humanitarian agencies in particular and sector-based clusters, so each with a desire to maintain their own footprint and systems and slice of the funding pie. So I think in the development sector, we often talk about working ourselves out of a job. But I think when the reality of what that looks like in terms of coordination and localization, when that becomes costly, there's multiple excuses for why it isn't possible or desirable. So I think that competition amongst agencies is a real key barrier at the moment.
Great, thank you, Sarah. And Salma, if we could turn to you, what do you see as the biggest blockage here?
Thank you. I'm happy to hear from others, and I think we're all on the same page. I believe one of the biggest barriers has to do with issues around different mandates and specific objectives of every organization. sometimes it's very difficult to align both. There are substantial business models associated with the different agendas and the different mandates for each organization, and different timelines and funding arrangements, and this makes it very difficult sometimes to really working together more closely in linking humanitarian cash assistance to national social protection systems. Thank you.
Great, thank you very much, very clear. And then last but not least, Maisa, can we hear from you? What do you see as the biggest barrier?
So actually, hi, I think like I do agree with most of the things that have been said so far, but technically the major blockage or the challenge I see is the inconsistent coordination, or actually the absence of complementarity of efforts or actual alignment of national social assistance programs with international support in terms of like language, personalities, regulations, and guidelines. Also, yeah, I think it covers everything so far.
Thank you so much, panelists. And what a great way to get us started, talking about systems which don't share language, which don't share guidelines, which don't share coordination systems. So that's where we are. And I hope over the next hour and change, we will we'll understand more about where we're going to get to. So we're already running a little behind, which is my fault entirely. We're going to turn first to Zara. So as I mentioned in the intro, Zara is speaking to us wearing not one, but two expert hats. So right now, she's the newly arrived social protection and humanitarian cash specialist for UNICEF in the region. So working for a particular agency and with a focus on the MENA region. And before this, she was working with the Grand Bargain cash subgroup on linking social protection and humanitarian cash transfers, looking at the global picture on the links between the two and supporting an overall mapping exercise where we were trying to understand, she was trying to understand the state of play across the world. So it'll be great to have you here with your two hats on, Zara. How do you see the current state of play across the region in terms of linking social protection and humanitarian cash? And what would you list, what would you pick out as the emerging priorities in this space?
Thanks for this, Sophie. And if we can just go straight to the next slide, knowing how we are pressed for time. First of all, thank you, CaLP, for the invitation to UNICEF to be able to come and present. It's great to be part of this really broad all-woman panel, and congratulations to CaLP on all the different products and what you guys are doing in this space. I think it's really, really valuable and very much along the lines of what CaLP has said they would do. So congratulations to Global CaLP, but also MENA CaLP. I'm not going to spend a lot of time because I feel like we've been hearing these things since this morning, and we've been hearing about them since since COVID started, basically. But in terms of if we look at current social protection responses, and obviously UNICEF, we look at it from a child poverty lens. However, when we talk about social protection, we look at it with the life cycle, so it does apply across the board to most of the population. We are looking at fragmented and weak systems. We've heard about this, there's nothing new. So there will be these gaps in coverage. We are seeing poor financing. You know, literally everybody has talked about it right now in terms of, Ms. Abu Sarah from the Jordanian government saying, you know, this is one of the key blockages, key problems. What are we looking at in terms of financing? There is low spending happening, specifically around children as well, but what are we going to be able to do with this? Also, which we've also heard this morning, is social protection systems in MENA are not shock responsive, particularly during the COVID response. What we have seen, so I don't know how much I actually do agree with the statement, Sophie, that you put out at the beginning, which I am trying to find what it was, like, do we agree or do we not agree around this, in terms of, you know, that the linking is slow and that the progress is slow, etc. I'm seeing a lot happening around social protection. I'm seeing humanitarian actors coming in as well. Just because we haven't actually linked doesn't mean that, you know, that the linkage is not happening. We have to think and rethink about how we talk about linkages. But we have seen that we haven't been particularly shock responsive. However, we have seen governments doing some amazing, absolutely amazing work in the expansion across the world globally. And I think Ugo is still on here, but yeah, Ugo and my colleague from UNICEF, Pamela Dale, they've been putting out that report on social expansion and what that looks like. So, but we know that this is something in MENA that needs more attention, and what is it that we can do around this? Next slide, please, because we'll talk a little bit about the emerging priorities. We had conducted a study, and I know I passed this on to somebody. Thank you, Diksha. She's just put that link in the chat box, and I think it's a good one for people to take a look at really quickly, because it's a study that was looking at, you know, where can we be supporting efforts to strengthen linkages between humanitarian cash transfers and shock responsive social protection systems. The study was around social protection systems, and then we're trying to figure out where do we look at those linkages, where are those gaps in coverage. The needs, which everybody again mentioned as the main blockages, and I know that my colleagues' presentations will touch on these parts, is look at preparedness. And because of the preparedness and the work that has been done, we've seen governments that have been able to expand very, very quickly. But, you know, we have to look at the preparedness side of it. There's a lot of talk around social registries, information management systems. So we need to move from ad hoc programs and look at interoperable systems, not just within government, which is where the UNICEF perspective would be, the social policy side of us would be coming in with, is to help around social registries and in interoperability of systems. I still have a minute left to go, Sophie. We know that we're looking at scalability of payment systems, the work again of Jordan and the National Assistance Fund, I think NAF. I don't know if I'm getting that correct or not, but you know, how they were able to scale up really, really quickly. Public financing, we've talked about that again already. One of the things that hasn't come up, but I've seen it come up in other sorts of areas, is monitoring and evaluation systems so that we have evidence-based programming. From the government side, this is incredibly important, because when you're writing policies, laws, legislation, you need to make sure you have a very, very strong evidence base, because this is a country, you know, so you need to make sure you have that. And the other thing that we've talked about a lot is around implementation capacities. So this is just, capacity building efforts. What does that look like? The next and last slide, because I've got 3 sort of key recommendations for the humanitarian cash transfer or CVA actors in MENA, and things that, again, have already been mentioned. Coordinate with social protection actors. And I come from a humanitarian CVA background, but I'm a full-on convert to the social protection side. Like, you know, proactively find those linkages and avoid recreating the wheel. In the chat box, there's this whole conversation happening, like, where's the regional social protection group, you know? So let's find that and then look at it from our side. Luca in the chat box as well, from Gaza, Cash Working Group, he's done a lot of work around linking to existing social protection systems. So let's look at that, or coordination groups. So we must be looking at that. We've already talked about explore options for linking humanitarian cash transfers. I want to make this distinction that it's not the other way around. You know, this is a social protection system is not something you are going in to use. Let's be very clear about our words that we use. You know, so you are not using the system, you are there to support the system. So let's look at how we can be supporting a system in terms of linkages. Do no harm. We already know this. You know, you have to keep the humanitarian imperative in mind. It's the last thing that you had said, Sophie, as well. Like, you know, there are areas, situations where we have to be quite careful, but we need to understand the role of the duty bearers and the governments and what they can do, and what their responsibility is. We do want to work ourselves out of a job. That is part of our exit strategy. That is the correct thing to be able to do. And with that, I will go ahead and stop. Thank you very much.
Thank you, Zara. Perfect timing. And also, as you mentioned this morning, what a novelty to have you on the other end of the webinar process, and brilliantly done. So thank you for getting us started on a positive note. The key takeaway from that, I think, is that progress is happening. Zara's painted a much more positive picture than I did in the introduction. So that is great to hear from someone who has looked across the world at all social protection, humanitarian cash linkages. Brilliant, thank you. So we now turn to Kaula Abu Sarara, who is the Head of Analysis and Programming at Jordan's National Aid Fund and leading on electronic payment systems. So Kaula has a background in academic background in computer science and is now the key point of contact for the National Aid Fund for liaising with humanitarian partners. So is in the perfect position to tell us how it feels from the government perspective to work with humanitarian actors. What is it that makes for productive partnership, and what should humanitarian actors be doing differently? So Kaula, what has been your experience of working with humanitarian actors to deliver assistance from the government perspective, and what would you like to see us doing more of or doing differently? Over to you.
Thank you very much. To start talking about our relationship with the humanitarian actors or agencies in Jordan, I want to give you a quick brief about our work and where we start to work with the humanitarian agencies in Jordan. If you see in this first slide, we have in Jordan, in NAF, two main programs that we work with cash assistance for poor people. The first one is monthly cash assistance, and the second one is, which we call CaLP, is a quarterly cash assistance. In both programs, we cover around 165,000 families, which represent about 60% of the poor families in Jordan. This is before the Corona crisis or COVID-19 crisis. In Corona crisis, of course, the number of poor households expand and reach about 450,000. We cover during the crisis around 93% of them by helping them with cash assistance. Next slide, please. Where our first start working with the humanitarian actors in Jordan, it started from the next program, the second program, which is CaLP program. Here we started to work together. We implement and design the program together. They help us in implementation, in design, in preparation for this program. In all of its stages, they were with us together, and this lead us to respond for the crisis in a good way. That all of you, and I'm very happy to hear from all of you that it was a good response from Jordan government for the crisis in the social protection side. The next, please, the next slide. I give you an examples here where we work together with the humanitarian actors at NAF. We started implementing the system, starting with implementing the targeting system together with all of humanitarian agencies we work with, like WFP, UNICEF, World Bank. We work together in this. We created together a national unified registry that have a database of all of the data that you can gather from the government and non-government entities, and this was with World Bank. We built a single online portal for registration, for household to register for our programs, and this was happened with the help of UNICEF. We implement an e-payment system, and we move from paying cash through post offices for the poor people to pay for them through electronic payment system like a bank account or e-wallet account. And this happened with WFP, with the help of WFP. The financial and technical support also, we are supported from all of our partners, and like DFID, USA, the WFP, World Bank, UNICEF, all of them help us in financial and technical support. This make a good platform when the crisis of Corona came. Our systems are there, are ready. People already registered in and have them. We have their data in our database, so it was very easy not easy from the word easy, but it was more easy for us to respond quickly because we have the data, we have the system, we have the e-payment system. So what we need is to communicate with those people and ask them to reply and tell them that you are will benefit and you will have cash assistance from NAF programs. This cooperation or this work together gave us a big experience in NAF from all the world, because we are working with all the national agencies that have an experience from all the world, and we reflect these experience and these practices in our systems to reach the best practice and to have the best solutions for every thing. For the next slide, please. What this is from my, what I think, if we could have a national system that all of the workers that work with the social protection in Jordan to have one window or one gate to register all the poor people, Jordanian or non-Jordanian refugees from anyone have a benefit or been helped in Jordan land, to be registered in one database, so we can all have a full view of all of the poor in Jordan, and we can all share this information and benefit from this information to have the exact number of poor that need to be helped without looking for their nationality or their if they are Jordanian or not. This is a big project, I know, but maybe thinking of it worth the thinking. That's all what I have from my side, and thank you for your listening.
Thank you so much. And I think you've hit on this issue that is, for all of us working in this field, so important and yet so difficult. How do we, it's all about data. How do we share data in a way that enables a joined up response, but which keeps people safe? How do we share data, as you say, in a way that's inclusive? How do we make sure that we're covering everyone in need? I think that's a brilliant question to leave us with, and thank you very much. So I'm sure that this data issue will come up again as we move through the presentation. Thank you. So turning now to Haneen Syed. So Haneen is a lead specialist at the World Bank working on human development and social protection in the region. An economist by background, she's based in the World Bank regional office in Beirut and covers in particular Lebanon, Syria, Jordan, Iraq, and Iran. So Haneen, turning to you, the World Bank obviously plays a critical role in supporting government-led social protection systems. What do you do? How does the World Bank respond when the reach of these systems is limited, or when vulnerable groups, for example, refugees and migrants, are excluded from national systems? And then linked to that, how would you like to work differently with humanitarian actors, with other partners? Over to you.
Thank you very much, Sophie, and everyone for inviting us. And I congratulate you on this all-female panel. And if you don't mind, I will not turn my video back on because I'm having some internet weakness here. So, but do let me know if I cut off or I mean, you can't hear me well. So, actually, I want to begin with what Khawla from the National Aid Fund in Jordan just presented. A very impressive presentation. And when we talk about what the World Bank does in terms of helping government-led social protection systems or supporting them, I think Jordan is really a great example. We've been involved in Jordan for more than a decade, helping the NAF, and in a way, us and the partners, all that effort has borne fruit, because when this crisis came, there have been others, of course, in Jordan, they were really quite prepared. So this is really the way to go. Build the systems, build the systems, build the systems in all of their dimension before you have the, to be prepared for a crisis. And now, moving then to the other example, the other country that I work on heavily, which is Lebanon, which is unfortunately can't say the same kind of success, although we also have been involved for a good 10 years, if not more, since the very beginning, the inception of the National Poverty Targeting Program. But when this crisis came, even before COVID, Lebanon, as you all know, is going through a severe financial and economic meltdown, if you will. The systems are not there. The MPTP is small and not very well funded. Registries are not there, unique IDs are not in place, M&E systems very weak, grievance redress systems as well, and so on and so forth. So, I mean, the one thing they did have was they worked hard on the targeting mechanism, but if you can't fund these programs well enough, then you really are not going to have much impact. So this is very much what we focused on. Now, the Syrian refugee crisis in 2011, November, October, and in fact, it was almost that same year that the National Poverty Targeting Program in Lebanon was launched. So come the Syrian refugee crisis and the very large influx, and what we saw was, from the World Bank point of view, initially, as the World Bank as a development agency, we didn't have much role. This was kind of a humanitarian crisis, even to the extent that some people thought at the time that this was a temporary, refugees will come and then turn back and go in a year, what have you. And so we didn't play much of a role. But then by 2014, when we saw, obviously the number then had almost peaked in terms of refugee influx in Lebanon, and we saw that the humanitarian system, which had really geared up and had in fact gone from a phase when at the initial WFP was doing paper vouchers for refugees, and that had a lot of problems with it. But they then moved in 2014 to a more electronic based system. We looked at it, we said, wow, that's really working well. Why don't we introduce that for the Lebanese, for the national system? And this is where the conversation began with the government. We said, you know, these are really good systems that are coming with the humanitarian community, and why don't you take advantage of them? So from our point of view as World Bank, the emphasis was to bring in these good practices from the humanitarian actors and community into the national system. I mean, this has been mentioned already by some speakers, but I think this is really where, because the issue is not just refugees and migrants not being well covered, but even more so the Lebanese population. I don't like to compare poverty between refugees and Lebanese because that's not really fair. All, you know, there's poverty across, and all need to be, you know, attended to. But essentially, I would say I'm very positive in a nutshell on what the humanitarian community has done. And you asked about the progress. I think progress, you think it's slow. I've seen it actually very impressive. Yes, it could be, maybe there are areas, and we could speak about them, where more progress needs to be done. But our experience has been that a lot has been done, including in Jordan also, where I've worked for many years as well. So that's been the main emphasis, is try to build the national system. And there's many dimensions to that. One is about, it's beyond capacity, by the way. I think capacity in terms of the classic definition, oh, you resolve capacity by bringing training, that is the easiest thing to do. But it's more of unblocking the governmental decision-making, the governance of the system, so that you can have money flow through the government system. Because I think ultimately that's what you want to need to have, whether it's coming to for nationals or it's going for refugees. If we really want to talk about building one system for everyone, you're going to have to strengthen the government system. That's what you can do, what's going to go to scale, and that's what's going to be able to give you the development impact. So my view is that, you know, that we continue to bring those learnings from the humanitarian community. I think on the humanitarian actors, yes, a lot more coordination needs to happen, because by definition, humanitarian actors are very diverse. So they will have different interests, what they bring into this. I think one key issue that we have been facing in the case of Lebanon, but Jordan also, Hawla spoke about this, is the uncertainty of funding. Humanitarian funding by definition is annual, short-term, while development needs have to be planned over a couple of years. And this is something that, of course, the World Bank has been advocating as much as possible. The countries themselves have to create fiscal space. This has been a huge challenge, in fact, for Lebanon, for Jordan even. Jordan has done better, but that continues also to be an issue. And I think that this, again, as World Bank, this is where we try to help them work through analytically where they can create fiscal space and the reforms that are needed, reprioritizing social safety nets and social protection more broadly. So let me stop here, and happy to expand as we go along. Thank you.
Thank you so much, Haneen. And I see a ton of interest and additional questions in the chat box, so I'm sure that you will get many questions at the end. But thank you for helping us see some of these problems from a non-humanitarian lens. I think you're absolutely right. Capacity building is our answer to everything. And as Paul said in the previous presentation, and as Zara mentioned at the beginning, you know, this is not about humanitarian actors marching in and using national systems. This is about, as Laurent from WFP said last week, this is about helping to the extent possible, build and support systems that are going to work in the long term and hopefully be inclusive. So thank you very much for bringing that perspective, and I'm sure there will be lots of questions for you at the end. So turning now to Sarah. So Sarah Palmer-Feldgate is a social development advisor with DFID Yemen, leading on social action, gender and inclusion. Before her life with DFID, Sarah worked for ELRA's Research for Health and Humanitarian Crisis Programme, strengthening research and innovation partnerships to improve humanitarian outcomes. So, Sarah, we started this panel with the hypothesis that there's been a lot of talk and relatively limited action. And that hypothesis has been challenged by all of our participants so far, all of whom see more reasons to be optimistic than I did in the introduction. Can you help us to understand what this looks like from the donor perspective? Where do you see progress, and where would you like to see more action? Over to you.
Thanks, Sophie, and thanks, for the time to share today and for the invitation to be part of the panel. I think there's three areas where I wanted to comment on progress that's been made, but also real opportunity to deliver more strongly on this agenda of harmonisation between humanitarian cash and social protection. So those are the three areas are that we've seen real consensus on the value of cash. We've seen real commitment to capacity strengthening of national institutions, but we do need greater courage for change and to really take forward this agenda of cash harmonisation and what some of the technical priorities are for that. So starting with the consensus on cash then, I think it was really clear from the State of the World's Cash report launch last week that cash is now a major part of almost every humanitarian response. I think it said 91% of contributors have seen an increase in donor support for CVA. And absolutely, I think we're no longer having to make the case for why cash is such an invaluable tool. And that's really strong progress that we can celebrate. There's been a real shift in the narrative around the potential for cash to shift power from agencies to recipients and to empower affected communities who are those who know best how to protect themselves and their families. And I think actually COVID-19 has also helped to really enforce the case for why cash is such a valuable modality, and has highlighted the need for anticipatory action, and in theories it's reinforced why localised humanitarian action is important as travel has become much more restrictive. But saying that, I think in last week's webinar on the State of the World's Cash report, Hiba articulated so well that there's still substantive challenges facing cash programming to deliver on the real transformative promises of cash, and scale isn't everything. So I think the next challenge is really to ensure that the integration or the better, closer alignment of humanitarian cash and social protection really delivers on some of the inclusion objectives and also the multiplier effects that it promises. Now that we've achieved a consensus on cash as modality, I think we need to shift much more onto how cash programming is actually being implemented in practice, and how we can really multiply some of those benefits of cash. So second, around the commitment to capacity strengthening of national institutions. There's an increased recognition from donors and agencies delivering CVA that the issue of sustainability is critical, and lots of people have touched on this today, that preserving and strengthening national institutions is not only the right thing, but with a predicted retraction of humanitarian funding, there's even more need for sustainable and local responses to protect the world's most vulnerable. I think Yemen is probably one of the toughest contexts in the world to do this, but we've definitely seen real notable unity around a vision for preserving and strengthening national institutions. So, for example, recipients of Yemen's Social Welfare Fund are continuing to receive quarterly payments through the UNICEF Emergency Cash Transfer Programme, and the World Bank looking at how to strengthen the capacity of national institutions such as the Social Fund, as part of a longer-term transition back to nationally owned social protection system. But I think it's really critical for donors that we're addressing the same sustainability question, and it's encouraging to hear the increased dialogue around this. But I think what we must come to next is really putting this commitment into practice, which leads to my final C, which is the change. So as donors, we would really like to see much greater progress on cash harmonisation, seeing that as a step towards strengthening national social protection systems over the longer term. And I recognise absolutely there's a role for donors in incentivising this change and reform, which is something we're certainly exploring in the Yemen context. But we'd also like to see much greater engagement from UN agencies, but also INGOs and national social protection institutions implementing CVA in the MENA region, in order to see progress on the commitments, which I think have been really helpfully set out in the UN Common Cash Framework, but we potentially haven't seen as much progress as we could. So just sort of going back to my earlier comment on the turf wars between humanitarian agencies or cash implementers, I think it requires real courage to put aside some of those competing agendas. It also requires real courageous leadership from the UN and the World Bank and others to work with local, state and non-state actors to make progress. And just finally, it requires courage to overcome what is actually a multitude of technical barriers to achieving cash harmonisation, notwithstanding unexpected crises such as COVID-19 into the mix. I think there are some significant barriers, but working together, I think we can sort of sequence these and make real progress. So yes, in agreement with your hypothesis, I think there is a way to go as well.
Thank you so much, Sarah. Really interesting reflection that, yes, of course, while coordination between governments, development actors, humanitarian actors is the problem that came out in the State of the World's Cash report, I think you also make a great point that a step on the way in order to get there is the humanitarian community getting its own house in order. We have some internal coordination and harmonisation challenges to address. And as you've said, they're political as well as technical before we can think about linking up better with national systems. Great points. Thank you very much. So turning now to Salma Zaki from WFP. So Salma is a social protection officer with WFP's MENA office, working on strengthening WFP's engagement in support of national social protection systems across the region. What's great about having Salma on the panel is that she brings the perspective both of humanitarian operations and also of working from the government perspective. So she's previously led WFP's operations in South Syria and has also worked as a researcher on child protection with the government of Egypt. So Salma, WFP just published their offer on social protection, and I think Paul's already shared in the chat some excellent resources from Claire O'Brien looking at the basics of what's needed to work better between humanitarian cash and social protection systems. What does WFP see as the role of humanitarian actors in supporting governments as they respond to shocks? And can you give us some examples from the region of how this is working? Salma, over to you.
Thanks, Sophie. And let me start by thanking everyone for having us in this and for arranging this, multi-sectorial and multi-stakeholder webinar. And let me start by agreeing with the Zahra that we're seeing increasing, engagement by humanitarian actors across the region with the social protection sector, and demonstrated flexibility increasing by most of the actors at both sides, at the humanitarian actors, government side, and even at the donor side, in which would all contribute to a stronger engagement between humanitarian and social protection actors. WFP, like many other international humanitarian actors, has been increasingly also working on building national systems and shifting from short-term to long-term approaches. WFP and World Bank have worked together on producing a very interesting paper, which I assume many of you may have seen in 2018, on bridging the gap between humanitarian assistance and social protection. And I wanted to start my presentation by giving a conceptual framework of what it means to bridge the gap between humanitarian assistance and social protection, but I've seen that it's been massively covered by previous presentations. So this chart is basically from this document, and it shows the different interpretation that could be used to understand what it means to move from, or to bridge the gap, or to link humanitarian assistance to social protection. And as we can see, the horizontal arrow demonstrates that by moving from humanitarian to social protection is really to move from internationally led interventions to nationally owned, while the vertical arrow shows that by moving from humanitarian, or bridging the gap between humanitarian assistance and social protection, we mean moving from short-term or emergency response to more longer-term assistance. I wanted to reflect on this and just say that the model of working outside or with limited engagement of government systems may be driven by several constraints and challenges, including risky operating environments and pressure to provide life-saving interventions, or possible lack of government's sovereignty over a territory in full or part. And sometimes, which is something that we see a lot in the MENA region, is that legal frameworks and legislations prevent some countries from including certain groups under national social protection systems. So there are a number of challenges that at some point, make it very difficult to move from emergency or humanitarian to a national social protection systems. There are also many major challenges, differences between both humanitarian and social protection systems that were mentioned by my previous presenter, including funding arrangements and legal frameworks and institutional arrangements, which also makes it difficult to reconcile the international nature of much of the humanitarian assistance with the demand for increased national ownership. Moving on, we can see in the next slide. So this slide is reflective of WFP's engagement in the region in support of national social protection system, and this was pre-COVID and has been expanded massively after COVID. And in this map, we show that it shows that WFP engages in different ways in the different countries, drawing on decades of expertise in safety net programming and technical expertise in analysis, assessment, program design, delivery system, and accountability to affected population. In some countries, we're providing technical assistance, meaning guidance to the governments on how to improve or expand the coverage, or support in assessing impact of different shocks on vulnerable groups, or in assessing policy options for social protection responses or rapid responses. In some others, our technical assistance is paired with service provision, and this is where we're implementing parts of the social protection programs on behalf of the government, or channeling our own assistance through existing national social protection systems. And in many other countries, we're complementing national social protection systems by aligning our own directly implemented programs, which are not really channeled or branded as government programs and cover excluded groups from national social protection systems. But we're, as mentioned in Gabby's presentation, we've seen a number of models of of fostering linkages between humanitarian and social protection systems, And many of these were really on how to align the humanitarian assistance. I won't go into details because I think many of the examples that were mentioned were just to the point and were excellent. Ideally, we adopt a holistic approach in supporting national social protection systems to ensure coherence between the different components. And we work very closely with the bank, with the World Bank, UNICEF, ILO, UNDP, and others. Of course, building and drawing on each organization's comparative advantage and to ensure complementarity. Moving on, and please let me know if I cross my time. So these lessons learned are also taken from this document, which is really one of my favorites, and is very reflective of the reality. So I've selected a number of lessons learned that we have agreed that are covered in this document. One is, in fostering linkages between humanitarian assistance and social protection, leadership and engagement of national authorities, where appropriate, of course, is key. And by that we mean that the entry point for assistance in any country should always be through the national government, but where feasible, of course, because in some countries that's not feasible for various reasons. The second is that, especially in low capacity contexts, a crisis presents a trade-off between the degree of ownership and the range of dimensions such as timeliness and accountability of interventions and of support. So when crisis hits, the design of response entails several core choices. The first of these may be a trade-off between national engagement and ownership and the speed of the response. Third is around the importance of shared planning and preparedness, which would help minimize unintended consequences later on. There are always opportunities for effective collaboration between actors working in social protection and in emergency response, and this can be improved and increased if there is a unified vision on the diagnostics and the solution later on. And then the last but not least, there's this point is one of my favorite. There isn't always a neat separation between social protection, humanitarian and social protection systems. As already mentioned and emphasized by all, I think, speakers today, there are so many ways in linking both, and it's not always a mutually exclusive, decision or choice. Both can coexist and both can complement each other depending on the context and a number of enabling factors. And last is also a very important point and is very relevant to the MENA region, where we have many low and middle income countries which are actually stretched financially, and social protection systems are very stretched financially, institutionally, and administratively. So this should be taken into account as we try to draw on linkages. There would be still opportunities to draw linkages, but it will take, of course, time, and it will require a clear understanding of where we stand today and where we're headed. So these are more or less the lessons learned that I wanted to share with you. Thank you, and I'm more than happy to receive any questions that anyone would have. Thank you.
Brilliant. Thank you so much, Salma. A really clear summary of some of the lessons learned by the biggest humanitarian cash actor in the world across the region. So having heard from WFP, from a huge international humanitarian actor, and what they've learnt from this area in the region, we're going to turn now to national society, to the Lebanese Red Cross. So last but by no means least, welcoming to the panel Maisa Ibrahim, who leads the Basic Assistance Programme for the Lebanese Red Cross. Maisa joined the Lebanese Red Cross in 2012 as a volunteer at the Emergency Medical Services Department, and has worked since then as a trainer and on quality and accountability. So turning to you finally, Maisa, looking in particular at the Lebanon case, which is of course what you're working on, what do you see as the role of local actors in helping support these linkages between humanitarian cash and social protection? And then what do national actors, national societies need, both from governments and from international humanitarian actors? Over to you.
Hi. So first I would start in general, just to say that I think that as a result of the protracted crises hitting the region, like local organizations and national societies in general had the opportunity and actually like built the capacity to design cash programs or support the government with cash-based programming, especially when it comes to like approaches under the social protection umbrella. On the other hand, there's a really very important point I would like to discuss. Being a national society is somehow different. We're not like technically a national society. We're not an NGO. We're not an INGO. We're neither a governmental organization. So there are things which we can do that others can't actually do. We're auxiliary to the government in some places, especially when it comes to disaster responses or preparedness. Therefore, we're like in the room and we can do both relief and development. Yet we're driven by our humanitarian principles and mandate. So there are things that also others can do which we cannot actually do in order to protect and maintain our neutrality and impartiality. Therefore, our coordination and relationship with other actors, whether from the international humanitarian organizations or from other local actors or from the governmental organizations, is much affected by our privilege, but also our need to balance and abide to our mandate and like sustain our neutrality and impartiality. Actually, the biggest plus in our case within the movement, the Red Cross, Red Crescent movement, especially when we're talking national societies, we have the largest volunteers network globally, which are technically part of the local communities. And this means we can speak the same language of the local communities we're coming from. We have this proximity in terms of like understanding preferences and targeting of local communities, making sure that no one is being left behind. In fact, national societies are sustainable models, and our reputation is what built on trust, access, and perception of the communities we're part of. On one hand, we have prepared, capacitated national societies, especially if I am talking about the current case in Lebanon. Yet we're unable to invest in all of the capacity due to the pattern of like international humanitarian funding, which increases in the disaster phase and then dramatically decrease when it comes to like development and sustainability. We have, on the other hand, also undercapacitated governmental organizations in Lebanon's case, for example, as Haneen mentioned before, like the systems within MOSA, the Ministry of Social Affairs, are not here. We don't have, there is no registry in place. Targeting is still under development somehow. And this also makes the governmental organization, or technically this needs the governmental organizations to hold a clear, definite role when it comes to social protection or even cash-based interventions. And last, we have the international humanitarian organization, which are not yet completely ready to give local organizations power. And here where it's really important that like platforms and systems and guidelines are nationally owned to ensure that they're sustainable. The last thing I really want to say on that, I just think like we've all, like everyone within this discussion has highlighted on the importance of capacity building and like having unified systems and guidelines. But what I want to say at last is that we're all working towards the same overall objective. And in order to maximize impact and sustain it when it comes to social protection, both international organizations and governments needs to commit to aligning national social assistance programs with international support and commit to complement efforts or ensure the complementarity of efforts and processes. This is all what I wanted to share with you guys. And yeah.
Thank you so much. And what a brilliant note to end these presentations on. So yes, absolutely. Part of working differently with others, part of supporting national systems means the uncomfortable need sometimes to give up power, to give up resources, and to be willing to shift relative roles and responsibilities, picking up on what Sarah's presentation covered also. And yeah, your great note to finish us off with. We all have the same objectives, and so we need to commit to aligning our systems in order to achieve those objectives. Thank you so much. So I see there's a couple of questions already in the Q&A box. At this point, I was going to turn to our panelists to ask for their one-sentence answer on what we should be prioritizing in the coming 12 months. But because there's some great questions coming through, we'll skip that if that's okay. So what I am going to do first of all is there's a great question in the Q&A saying, which is a kind of two-part question. So I'd like to put the first part of this to Kaula and maybe the second part to Haneen, and then see if others are interested in offering opinions as well. So Carla Lacerda in the chat has asked us, are there any examples of actions or advocacy messages that have been effective in making social protection systems A, more inclusive, and B, more shock responsive? So maybe, Kaula, given that you left us on that note of setting out a vision for a more inclusive system, a single system that covers everybody, do you have any thoughts about what sorts of actions have been effective and could be effective in making social protection systems more inclusive? Over to you.
Thank you. From our experience, especially in the Corona crisis, we were lucky that we have all the data in our systems, and the people were registering before the crisis came, and this is make us think what could happen if we don't have this data, or we couldn't reach those people through our systems to help them. So we are now thinking of developing a system that can be a shock response system that can we use in any coming crisis. We hope it is not coming, but for the future to be ready to reach poor people or vulnerable people or affected people by any of these situations, to reach them without need to go by person. So we are now thinking of developing like a virtual home visit system that make us could visit the families at their home virtually through this system. Could talk to them, speak to them, know their situations, and if we need some documents or some proofs of their need, they can upload through this system. This is what we are thinking to do now, to be ready to the future if something like what happened, like the curve that we were in before about 2 months.
Great, thank you. So real emphasis there on the preparedness phase. If you don't have the data, if you haven't done the groundwork, then when shock comes, you're not going to be able to respond to it in an inclusive way, which leads perfectly onto the second half of the question for Haneen. So sorry to pick on you with this one, it's tricky, but what factors do you think have been effective in preparing social protection systems to be more shock responsive, to be more effective in response to shocks?
Hi, Sophie, thank you. I think really building on what was already said, a fundamental aspect to develop systems or prepare systems to be shock responsive is to have the basic building blocks of good social safety net in place. I mean, we can't overstress that. Now it's, and this includes everything that Kaula talked about, that Jordan and let's say Egypt quickly moved through, even Iraq has advanced on that. So I think we can't, overemphasize that to be ready for multiple and different kind of shocks. And definitely, I believe adequate financing and the right kind of financing from the international community, from the donors. The timely financing is very important. Thirdly, data, availability of good data that informs the policymakers as to what are the impacts and so on. So, I mean, these are kind of, they're not new solutions, but I don't think we are there yet in terms of, for all of our the countries where which are experiencing shocks in terms of preparedness. It's a very uneven landscape. So I think this is very much sort of something that needs to be focused on, zeroed in on, and working very closely, development and humanitarian actors working together. I mean, we've seen that the WFP presentation is exactly that, about how synergies between the humanitarian development and the expertise. Somebody mentioned that humanitarians don't have enough social protection experts. Well, certainly development organizations do. And, you know, we could work much more together in that. So I think these are multiple factors that are very important to be able to build these shock responsive systems. Thank you.
Thank you. Amazingly clear, and some great recommendations there for all of us to think about. If others want to jump in on that question, please let me know. But if not, there's another question in the chat which asks what particular challenges has the COVID response posed? And we've heard bits about that from different panelists, but I think it would be great maybe to hear from three of you, if we could hear quick reflections from Sarah from Yemen, from Maisa from Lebanon, and then back to Zara for any kind of, for the COVID overview, I guess, maybe wearing her previous hat. So Sarah, what challenges has the COVID pandemic thrown your way, and how has the response been in Yemen?
Yeah, I think the major challenge, particularly in the Yemen context, is just that it's been a bit of a beautiful storm of various factors. So in Yemen, we've not only had COVID, but that's added onto the context of cholera, onto the context of locust outbreak, onto very, very high levels of malnutrition already. And I think just going back to the sort of previous question, I think, you know, the lack of social safety nets, the lack of data has made the COVID response really difficult. So even in terms of assessing which options to reach, I guess we completely understand that the resources don't match the level of need ultimately, and so then making those decisions about how to respond based on very weak data, particularly in the north of Yemen, has made that really, really difficult. And I think that need for the data around levels of vulnerability, but also up-to-date targeting and up-to-date beneficiary lists is so critical to having a quick, responsive social protection response. So certainly that's been our biggest challenge, and therefore I think makes a really strong case for cash harmonisation and alignment between different cash programmes in order to have a much more responsive and adaptive system in place.
Brilliant, thank you so much. So moving from Yemen then to Lebanon, Maisa, how has the COVID-19 response and impacts looked in Lebanon?
So I don't want to say that in Lebanon it's similar to Yemen, because this is not the case, but actually in terms of also the complexity of the crises, or having multiple crises affecting the situation, was the most challenging part. So technically we shifted from having being affected by the Syria crisis and the influx of refugees, adding to that the economic crisis which hit the country starting September last year, and it's still ongoing with all the results of like the volatile exchange rates, the inflation, the unjustified increase in prices, and technically the the devaluation of the value of assistance which was being provided, adding to that coming the COVID-19 outbreak and the regulations which were also induced within the country. Like all of these were, like the complexity behind it was the main challenge, because technically there were a lot of needs, but yet like minimal coverage if we want to compare between needs and coverage. So this was the most challenging part, and especially that when it comes to like assistance, or like even in specific to cash assistance, the cash assistance in Lebanon was really based on a good banking system, which made it easy to deliver cash assistance to those in need of it. And after also the closure of the banks or the economic crisis that hit the country, it was a bit shocking for like everyone just to trying to figure out new modalities or like new ways to be able to deliver assistance. So restructuring our risk analysis was one of, and mitigation was one of the challenges we had to work on. And also like the increased amount of needs, especially on the local Lebanese community level, not only the Syrian refugee part, in comparison to the coverage, was also one of the challenges.
Brilliant, thank you. Again, very clear. So we've done a little reshuffle in the chat between the panelists, and we're actually going to call on Salma from WFP to give the regional perspective here. So we've heard, Salma, we've heard in depth from Yemen and Lebanon. Are there other countries in the region where there are notable features about the COVID response or the challenges that COVID has brought that you want to bring out for us now?
Yes, sure. So as I understood from the question, it was specific on COVID impact on, humanitarian cash transfers and how have this affected humanitarian cash transfers. And I would like to mention here, that like many other interventions, cash transfers have also been affected by the containment measures and the lockdown procedures that have been taken by the different, governments across the region. We have seen, challenges. People have seen challenges in accessing retailers and in accessing financial service providers in a number of countries. And we have also seen, that with additional caseload, because we have in many countries also added additional vulnerable groups in coordination with partners, that the capacity of financial service provider has not always been up to the level where they can absorb additional people, and that was also another key challenge. And then another challenge was with assessing the impact of COVID-19 on people in order to make informed decision of who to add to the beneficiary lists and who to add to our cash transfers, especially doing it remotely. Of course, we have our tools and we have our platforms to do remote assessments, but that has also been very challenging as well in providing the cash transfers. We have also adopted a number of procedures and measures to be able to handle these challenges, especially in terms, for example, on the need to minimize the number of people in accessing entitlements, and therefore, for example, we have done the distribution of assistance, for example, on twice monthly, or expanded the number of times where people can go and collect their entitlements. So there are a number of challenges, of course, and it's been a rough ride in providing cash transfers in context of COVID-19. Thank you, and over.
Thank you, very clear. So CaLP throughout the COVID-19 crisis has been kind of collecting some of these stories, some of these experiences of how our members have adapted to the COVID-19 pandemic, some of the challenges that they've overcome, and we'll be releasing a series of very, very short videos from a global meeting of cash working group leads over the coming days, and they pick up exactly on some of those issues. So looking forward to sharing those with you. So those of you who are watching the chat may have noticed that Zara responded to the shock responsiveness and the inclusiveness question by saying those are all great points, and there's an additional layer of political challenges that we need to consider. So there's a question in the Q&A box about whether we have examples of national governments who include refugees as well as their own national populations in social safety nets. So with that link to the inclusiveness question, Zara, what do you see as the key political barriers to overcome in making social protection systems more shock responsive and more inclusive?
Yeah, and I guess this is looking at, advocacy, one of the things that I put in there, one of the things globally that we were able to see in terms of inclusion, but in terms of COVID being an accelerator around these aspects, was the immense work of advocacy that was done ahead of time. Just repeating the words over and over again. I remember when I first heard the words social protection, I was like, what does that mean? But just getting that into the language, getting that over there, having those conversations with government over and over again. And this is where we have, organizations like UNICEF, like we've been in, I only found this out 4 weeks ago when I joined. We've been in the region for like 70 years. Our first office in Lebanon opened in Jordan and Lebanon. It was like 1950 and 1952. So we've been a partner of the government for a really, really long time. That relationship building, that trust building, working on the development side, trying to get these processes in place. I think, this is a huge non-technocratic part of the equation that really, really needs, we need to understand, acknowledge, and see that it is there. Because we may not have, this quick sort of, here's an SOP if you want to, like, all of a sudden there's a shock and you need to respond. But it can be, and this is part of one of the Grand Bargain webinars that we actually had with UNHCR, and it was, I think, the 18th of June that we did this webinar, but it was around inclusion of refugees and safety nets and what that looks like, and there was a brilliant example. It was a World Bank funded, we had a World Bank representative on that webinar, and it was Republic of Congo. And with COVID, they'd been doing all this work for like 2 years, and part of their fragility crisis situation, they had this whole entire funding line, and the government didn't even blink. They thought they were going to have to fight to get the inclusion of refugees in there, and they were like, oh yeah, but we've been talking about this, so let's just do it. It just wasn't a question, so, and it was because of the 2 years of talking about it. My understanding is from my colleagues in Lebanon, and Haneen can also, and Mesa can jump in on this one, that there is, COVID has accelerated a process around getting a wider consultation and talking about an actual social protection policy now, so just seeing like where those opportunities are. And it is because of the conversations that have been happening already. So the importance of conversation, I think, is a really, we have to talk about that. We have to look at that. In terms of inclusion of refugees in social safety nets, I'm thinking about an example, which has not quite happened yet, but I know it is in the works, in Libya. UNICEF has these Beiti centers, they're called, and they're like these centers set up for children. And what they are trying to do with migrant children that are there is to bring them in, do a cash transfer, but at the same time, the referral and case management side of it. Can they be referring these kids into the social safety net? And I think, that's, we can't, cash is wonderful. It is a magical, magical tool in a toolbox that has many other tools, and doing stuff. And, UNICEF comes from the cash plus or top up perspective on this side of things. Yemen, different from what we do. But looking at that case management referral side of things, and looking at, what is that cash plus angle? What is the top up angle? So, it's just a couple of examples from the region, but also from globally to bring into this. Thank you.
Brilliant, thank you. And there we had you firmly wearing your previous hat with your global overview. Thank you very much. Really great to hear. All right, so with a couple of minutes to go and no further questions in the Q&A box, what I'd like to do is re-put on the table this closing lightning round that we were going to have from all of you. And so we heard at the beginning about what you see, if you had to pick one key blockage, what do you think that blockage is? The question for each of you now, just before we close, is if you had one key message for the listeners to this call, one key thing that you think we should be doing differently or more of over the coming year, one thing that we really need to prioritize to get things moving, what would that be? So I'm going to pick on you in reverse order this time. Just one or two sentences, leave us with a bullet point to remember. Maisa, what would that priority be for you?
So technically, I would, again, stress on being or having this complementarity when it comes to efforts and aligning these efforts to ensure we have processes or guidelines in that would serve us or would induce impact, like larger impact and more of a sustainable one, empowering the local communities or the national societies in our case, because like technically these are the people who are the first responders in case of any crises, and in case of like when things are going well, these are the people who are in the community to work on the like preparedness and the capacity building behind it.
Brilliant, thank you. Very clear words to take away. Salma, what would it be for you, the one priority?
I would say for everyone to try and be more inclusive as they work on supporting, national social protection systems and national governments, and acknowledge that we're all here today for a reason, because we're bringing different angles and different qualities, and this is how things should always be. So yes, we have different mandates, and we have different objectives and probably business models and stuff, but we also have similarities, and I think we should focus more on similarities as we try to move forward. Thank you.
Brilliant point, thank you very much. Sarah, what should the key priority be from your perspective?
So I'd agree with those points. I think it's about acting short term, but thinking long term. So I think we need leadership and coordination for collective delivery of technical priorities to harmonise cash programming in the short term, particularly targeting and unified MIS, but to keep focused on the ultimate goal of strengthening national social protection systems and to provide that more sustainable and predictable response in the long term.
Brilliant, thank you very much. Haneen, over to you. What should our one priority be for the coming year?
I would say even closer and better coordination. This was one of the challenges you put out in the report, so I support that. I think we have to think of how to do it more effectively, because the next 12 months are going to be very critical. There isn't a lot of resources to waste. In fact, to the contrary, resources would be dwindling. So I think we need to look for coordination to have much more efficient outcomes in how we're working together. Thank you.
Brilliant. Thank you so much. As this has been the theme of the last couple of weeks of the big cash meetings and reports that we've been talking about, coordination seems to be the headline wherever we look. Increased coordination, improved coordination, leading to better outcomes. Thank you. Kaola, over to you for your key priority. What do you think we should be focusing on leaving this meeting?
We need to focus more on technology systems to depend or rely on the technology, especially in government, more than a human person, because of the weakness of the human skills, or to overcome of the weakness of the human skills, especially in government. I'm talking about as NAF. So we, in the next 12 months, we will focus in develop more systems and technology systems to work with.
Brilliant, thank you. Very clear, and agree. Data and the need to get on top of systems and data has been a consistent theme throughout this panel, and definitely something for us all to take away. Sarah, last but not least, the closing words are yours. What should we be prioritizing?
For me, it's funding. I want to understand. I want a matrix. We need a matrix per country, and I've got World Bank on this call and I've got DFID on this call. So maybe let's make Yemen an example of that. We need the 3 W's around funding. Who is funding? When are they funding? What are they funding? What is their mandate, roles, responsibilities? Can they be doing it on targeting? Can they be doing it on MIS? Who can they be funding? How can they be channeling their funding? The fact that we do not have a funding picture boggles my mind because there's so much money being thrown at this. Think short term, act short term, think long term, etc. Without a funding picture, we cannot do this. This is an absolute priority action. You know, from the UNICEF side, we are looking at public financing. We call it public financing for children. But in order to support government, figure out where all this money is going to come from for this gargantuan problem that we have, we need funding pictures by country. Thank you.
Brilliant. Very important closing words. As we all collectively look at this funding cliff, rising needs and plummeting available resources, we need to understand the funding streams that exist, and we need to make the most out of every dollar. So absolutely agree. I see it. I don't think it is Tom, because Tom's left us. It could be Rabia, someone anyway in the chat, saying that this is proving quite elusive, and certainly the work that we're doing in the country studies suggests that this data is more difficult to get hold of than it should be. But as you say, with the people we've got on the call, it should not be beyond us. So let's get a grip on the funding. So we've come to the end of our time today, and I just want to say a huge thank you to our wonderful panelists for shining a light on this complex issue from lots of different angles, and crucially for being so optimistic and so positive. You guys are the closest to this thing. You're making it happen, and to hear from all of you that no, our hypothesis that progress is slow is actually not right is very heartening. And I think we've seen lots and lots of opportunities to build on here. Thanks also to the previous presenters, to Paul and to Gabby and to my CaLP colleagues for sharing some excellent resources. I saw lots of questions in the chat about, are those resources available? Yes, they're shared in the chat. They're all on the CaLP website. A recording of this webinar will be available by the close of today, I hope. So any of your colleagues that missed it, please pass it on. I also saw what was really heartening in the chat is to see that many of you have been discussing in real time how to make this these processes work better. So I saw a conversation about regional coordination structures and the need to get the right people around the right tables together. Yes, absolutely. Let's continue this conversation. I think if any of you have had brilliant ideas as a result of what you've heard today, please feel free to ping either myself or my MENA colleagues. Yorgos, our regional representative who got us going today. Please let us know what you think and what you think needs to be done. We are at your disposal and would love to hear your ideas on this complicated issue. So a huge thank you to all of you for taking the time today. We hope that there will be more discussions on this important issue, but critically, we hope that everyone on the call, including us as CaLP, can take away some of the brilliant ideas and calls to action that we've heard today from the panelists, and that by the next State of the World's Cash report, if such a document exists, we're able to reflect on real concrete progress in making this happen. So huge thanks to all of you, and we look forward to the next discussion. Thank you so much, and good luck. Stay safe. Bye.